विकास सर।
हाँ जी, मैं यही हूँ।
सर थोड़ा वेट करते हैं 5 मिनट्स,
ठीक
उसके
है,
बाद देन वी विल स्टार्ट सर।
बिल्कुल बिल्कुल, कोई परेशानी नहीं।
So good afternoon everyone. Good afternoon everyone. I am Dr. Tanmay Singh from Gynaecology Animal Health. On behalf of Gynaecology Animal Health, welcome to all participants to our Gynaecology Vet Knowledge Forum. So in continuation of this web series program, so today we have episode number 4 and today's topic is managing bovine uterine disease for enhanced fertility. And it's our pleasure to have Dr. Vikas Sachan sir as our guest speaker for this webinar. So let me introduce our speaker, Dr. Vikas Sachan sir, Assistant Professor, Veterinary Gynecology and Obstetrics Division, Mathura Veterinary College. He is having 12-year clinical research experience and he has published 20 research papers and 40 popular articles, and also participated in the 50 clinical camps and farmer awareness programs. So today we will discuss about the managing bovine uterine disease for enhanced fertility. So sir, I am hand over to you for today's seminar.
Okay, thank you, Tanmay. So let us consider a cow looks healthy and totally physiological normal, and say it's comes in the estrus normally, ovulates at the proper time, sperm reaches to the proper site as well as in the optimum time frame to the oocyte, and there is the fertilization. But what happens if a thief steals the wealth of the conception in pregnancy? Then there is no productivity. Means this thief may be uterine infection or uterine inflammation. It is a silent killer for the dairy productivity. So hello friends, my name is Dr. Vikas Sachan. I am assistant professor from Department of Veterinary Gynecology. So आज हम लोग डिस्कस करेंगे बोवाइंस में यूट्राइन इन्फेक्शंस के बारे में, कितने तरह के रहते हैं, कुछ दिखाई देते हैं, कुछ नहीं दिखाई देते हैं, और उनका ट्रीटमेंट का एस्पेक्ट क्या रहेगा, उनकी पैथोजेनेसिस कैसी होगी, हमको क्या सिम्टम्स दिखाई देंगे फील्ड लेवल पे हम उसको कैसे डायग्नोज कर सकते हैं, हम इन सब चीजों के बारे में बात करेंगे। तो डॉक्टर तन्मय, शुड आई स्टार्ट विद शेयरिंग माय प्रेजेंटेशन?
Sure, sir. Please start, sir.
ओके, लेट मी। So please tell me, is it visible, the presentation mode?
Yes, sir. Now it's visible. Hello, Vikas, sir.
तन्मय, स्क्रीन प्रेजेंटेबल है?
Yes, sir. Presentable. It's visible. Well, you can start, sir.
ओके 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 ओके, थैंक यू। So today we are discussing about the bovine uterine diseases, its management for enhanced fertility. Ultimately अगर हम uterine diseases को diagnose कर लें तो उसको आसानी से manage किया जा सकता है और fertility को enhance किया जा सकता है। जैसे हमने बात करी कि if there is a problem in the uterus, whether it is inflamed or maybe infected, so conception will not take place. Sperms वहां पर survive नहीं कर सकते हैं, अगर किसी तरह survive भी कर जाए तो embryo वहां पर आके transplant नहीं हो सकता है अगर uterine environment inflamed और इन्फेक्टेड है। तो अपने इंडिया में जो प्रिवेलेंस है, कई तरह के यूट्राइन इन्फेक्शंस हैं, हमें सब पता है। जैसे एंडोमेट्राइटिस है, आप जानते हैं, कुछ दिखाई देते हैं, कुछ नहीं दिखाई देते। जैसे सब क्लिनिकल एंडोमेट्राइटिस के केसेस मिलते हैं, कभी कभी पायोमेट्रा मिलता है, मेट्राइटिस मिलता है। पोस्टपार्टम मेट्राइटिस की बात हो रही है यहाँ पर। पायोमेट्रा के केसेस सबसे कम देखने को मिलते हैं, बट एट द टाइम ऑफ स्ट्रेस हमें सब कुछ नॉर्मल दिख रहा होता है कि यहाँ डिस्चार्ज अच्छा है, एनिमल हेल्दी है, नॉर्मल साइक्लिसिटी है, लेकिन फिर भी एक यूट्राइन इन्फेक्शन अगर उसमें एग्जिस्ट कर रहा है तो इस तरह की चीजों को हम लोग सब क्लिनिकल एंडोमेट्राइटिस में शामिल करते हैं। और ये आज की डेट में रिपीट ब्लीडिंग का सबसे बड़ा रीजन है अपने इंडिया में। सो इंडिया जो प्रेवलेंस, एक बार कंसेप्शन लेने के लिए हाउ मेनी टाइम्स वी हैव टू इंसेमिनेट द एनिमल, तो उसके नंबर्स भी बढ़ जाते हैं। हमारा रिड्यूस फर्स्ट सर्विस कंसेप्शन, ओपन डेज, ये सारी चीजें बढ़ जाती हैं। ओपन डेज मींस जिस दिन से एनिमल ने काविंग करी है उसके बाद वो अगली बार जब कंसीव हो रहा है तो इसको डे ओपन बोलते हैं। एक काफ ईयर का कॉन्सेप्ट अगर अपने को याद हो तो ज्यादा से ज्यादा 84 डेज का डिफरेंस होना चाहिए। लेकिन अगर यूट्रस इन्फेक्टेड है, पार्चुरेशन के बाद यूट्रस इन्फेक्टेड है, तो कॉन्सेप्शन में टाइम लगता है, ओपन डेज ज्यादा होते हैं। हमें 1 साल में या 1.5 साल में एक बच्चा नहीं मिल पाता है, और ये डेफिनेटली एक इकोनॉमिक लॉस की तरफ ले जाता है। और इन्हीं सब चीजों के कारण जो अच्छे फार्म्स होते हैं, हार्ट्स होते हैं, वहां पर कलिंग रेट भी 3% तक देखा गया है। तो कहने का मतलब द इम्पैक्ट ऑफ द यूट्राइन इन्फेक्शन ऑन द फर्टिलिटी इज वेरी मैसिव एंड इट इज ए मेजर फैक्टर फॉर द इकोनॉमिक लॉस इन इंडिया। सो वी कैन से इट इज द मेजर कॉज ऑफ इकोनॉमिक लॉस। ये कैसे कैसे हो सकता है, मैं जल्दी से इस पे आता हूं। मान लीजिए अनहाइजीनिक काविंग मैनेजमेंट। काविंग के टाइम पर एक सर्विक्स ओपन रहती है, जेनाइटेलिया ओपन रहता है, जो एरियल माइक्रोब्स हैं वो सारे के सारे अंदर जा रहे होते हैं, कुछ बैक्टीरिया रहते हैं, प्रोटोजोआज रहते हैं, वो सब अंदर जा रहे होते हैं। यूट्रस का डिफेंस मैकेनिज्म उनको स्टॉप करता है। लेकिन हमारा काम ये है कि काविंग होते वक्त वो जो एरिया है जहां पर काविंग पैन है या जहां पर जानवर बच्चा दे रहा है, उस एरिया को हम हाइजीनिक रखें। अगर वो गंदगी है, पहले से वहां पर इन्फेक्शन है, तो कई दूसरे तरह के इन्फेक्शन भी बड़े आराम से अंदर जा सकते हैं। कई तरह के पैथोजेंस रहते हैं, एरोबिक भी हो सकते हैं, एनारोबिक बैक्टीरिया भी हो सकते हैं, ग्राम पॉजिटिव ग्राम निगेटिव भी रह सकते हैं। डिस्टोकी और एबॉर्शन के केसेस में यूट्राइन इन्फेक्शन देखने को मिलता है, क्योंकि ऐसे केसेस में रिटेंशन ऑफ प्लेसेंटा भी होने के चांसेस अच्छे रहते हैं, और हमारा सर्विक्स लगातार ओपन रहता है, यूट्रस एक्सपोज होता रहता है इन माइक्रोबायोटा से। उसके अलावा कभी कभी हमें एक पार्चुरेशन को इंड्यूस करने की जरूरत पड़ती है कुछ एनिमल्स में जो खुद से पार्चुरेशन को इंड्यूस नहीं कर पा रहे हैं, शुरू नहीं कर पा रहे हैं, तो उसमें काविंग इंडक्शन के लिए जो हम लोग ट्रीटमेंट देते हैं उसमें भी ऐसा पाया गया है कि रिटेंशन ऑफ प्लेसेंटा थोड़ा ज्यादा होता है, उसमें रिटेंशन ऑफ प्लेसेंटा उन केसेस में पाया जाता है जिसकी वजह से यूट्रस में इन्फेक्शन हो सकता है। और नो डाउट मोस्ट इंपॉर्टेंट इट इज द पुअर न्यूट्रिशन एंड पुअर इम्यूनिटी। यूट्रस क्या पूरी बॉडी में कोई भी अगर इन्फेक्शन है, अगर उससे लड़ने की हमारी रोग प्रतिरोधक क्षमता नहीं है, इम्यून सिस्टम अगर हमारा मजबूत नहीं है, तो फिर वो इन्फेक्शन बहुत आसानी से शरीर में लग जाता है। और इसके लिए सबसे ज्यादा जरूरी सबसे ज्यादा जो रिस्पॉन्सिबल है वो पुअर न्यूट्रिशन, because minerals and vitamins we are getting from our nutrition, that's only help to improve the immunity. So we have to take care of the immunity of the animal. Apart from that, the defense mechanism of body whatever it is, यूट्रस का अपना खुद का भी एक सेल्फ डिफेंस सिस्टम है। जैसे एक मैकेनिकल बैरियर है, इसमें सबसे बाहर वल्वा, वेस्टिब्यूल, सर्विक्स, ये नॉर्मल कंडीशन में बाहर के माइक्रोब्स या माइक्रोबायोटा जो भी है, या वेजाइना में जो सिंपल नेचुरल इनिबेंट्स हैं उनको यूट्रस तक जाने के लिए रोकता है। उसके अलावा एंडोक्राइन फैक्टर्स भी काम करते हैं, जैसे एस्ट्रोजन हार्मोन जिस भी साइकिल फेज में, जैसे हमें पता है स्ट्रेस फेज में एस्ट्रोजन ज्यादा रहता है, तो ब्लड सर्कुलेशन तेज होने की वजह से, ज्यादा होने की वजह से वहां पर ज्यादा ल्यूकोसाइटिक इन्फिल्ट्रेशन होता है और वहां पर ज्यादा ल्यूकोसाइट्स आते हैं, और जिससे आसानी से वहां पर पाए जाने वाले इन्फेक्शन को खत्म किया जाता है। अगर लेकिन प्रोजेस्टेरॉन की क्वांटिटी ज्यादा है तो ये इम्यूनिटी थोड़ा सा प्रोन हो जाता है यूट्रस प्रोजेस्टेरॉन की डोमिनेंस फेज में। प्यूरपेरियम पीरियड हम लोग बात कर रहे हैं पार्चुलेशन के बाद के पीरियड की, तो उसमें जो यूट्राइन इन्वोल्यूशन होता है, यूट्रस के अंदर जो भी डेड डेब्रीज, नेक्रोज टिश्यूज, कोटाइलेडॉन्स के पार्ट हैं, फीटल हेयर्स है, फीटल सेल्स है, फीटल फ्लूइड का कुछ रेमिनेंट हो सकता है, उसके अलावा मल्टीपल टाइप के पैथोजेंस हो सकते हैं, उनको यूट्रस खुद से क्लीन करता है, कॉन्ट्रैक्ट होता है और वो क्लीन होता है। एंडोमेट्रियम की वॉल वापस रीजनरेट होती है, यूट्रस वापस अपने नॉर्मल शेप साइज में आता है, मींस यूट्रस इज गोइंग टू प्रिपेयर इटसेल्फ फॉर द नेक्स्ट कॉन्सेप्शन, नेक्स्ट प्रेगनेंसी। इट इज द प्यूरपेरियम पीरियड। तो ये भी यूट्रस का डिफेंस सेल्फ डिफेंस मैकेनिज्म है कि अंदर आए हुए सारे पैथोजन या सारी गंदगी को वो बाहर निकालता है। और ल्यूकोसाइट्स नो डाउट बॉडी में हर जगह ल्यूकोसाइट्स ही फाइगोसाइटोसिस के लिए रहती हैं, किसी भी तरह का इन्फेक्शन आएगा तो ल्यूकोसाइट आएंगे और बैक्टीरिया को मारेंगे, या जो भी माइक्रोब्स है उनको मारेंगे। तो यूट्रस का अपना सेल्फ डिफेंस मैकेनिज्म है। कुछ बेसिक चीजें बात करते हैं, जैसे पैथोलॉजिकल कंडीशन है, जैसे कोई हमने डेड फीटस, जैसे अबॉर्शन के केस में, या कोई वीक फीटस, या पार्चुलेशन को इंड्यूस करने के लिए हमने दवा लगाई है, या रिटेंशन ऑफ प्लेसेंटा हो रखा है, या जेनाइटेलियम किसी तरह का ट्रॉमा है, तो इन सब केसेस में जो ये फैगोसाइटिक एक्टिविटी है ल्यूकोसाइट्स की, मतलब कह सकते हैं यूट्रस का जो डिफेंस मैकेनिज्म है वो कई दिनों तक और कई हफ्तों तक वो डिप्रेस रहता है, कम रहता है। और अगर इम्यूनिटी सिस्टम इज डिप्रेस्ड इनसाइड द यूट्रस, देन डेफिनेटली देयर इज द मोर चांसेस टू गेट इट इन्फेक्टेड। ओके, सो एक थोड़ा सा इलेबोरेट करूंगा मैं पोस्टपार्टम पीरियड के बारे में, क्योंकि ज्यादातर इन्फेक्शन के केसेस हमको पोस्टपार्टम में मिलते हैं, जिसमें मेट्राइटिस भी शामिल है और एंडोमेट्राइटिस भी शामिल है। तो पार्चुलेशन के टाइम से लेकर के यूट्रस जब तक कंप्लीट ओवुलेट इन्वोल्यूट नहीं हो जाता, तब तक उसको इस दौरान को उसको पोस्टपार्टम पीरियड बोलते हैं। और इसको 3 फेजेस में बांटा जा सकता है। ये बहुत एकेडमिक इसको मत लीजिएगा, एक्चुअली में हम इसके बारे में इसलिए बात कर रहे हैं क्योंकि डिफरेंट फेजेस में यूट्रस का एनवायरनमेंट डिफरेंट है। हर फेज में अलग तरह के बैक्टीरिया, किसी में दूसरा बैक्टीरिया, किसी में तीसरा बैक्टीरिया के जो एग्जिस्टेंस है वो ज्यादा कंसंट्रेट होती है, ज्यादा एग्रीवेट होता है। तो वो हमें अगर जानना है तो हमें ये समझना पड़ेगा कि कौन कौन से पीरियड हैं, इसमें किस तरह के माइक्रोबायोटा यूट्रस में एग्जिस्ट करते हैं। अकॉर्डिंग टू दैट ओनली वी कैन गो फॉर द प्रॉपर डायग्नोसिस एंड एप्रोप्रिएट ट्रीटमेंट। अगर हमें पता ही नहीं होगा कि वहां पर एरोबिक बैक्टीरिया है और हम एनारोबिक वाली एंटीबायोटिक लगा रहे हैं, तो इट इज नॉट गोइंग टू द क्योर साइड। और अगर मान लीजिए एनारोबिक इन्फेक्शन है और हम कोई ऐसी दवा लगा रहे हैं जिसमें एरोबिक बैक्टीरिया को मारने की ताकत है, तो वो एनारोबिक बैक्टीरिया वहां पर एग्जिस्ट कर जाएंगे। तो हमको पहले ये समझना पड़ेगा। तो मैं बात आगे बढ़ाता हूँ। अपना पोस्टपार्टम पीरियड को 3 हिस्सों में बांट सकते हैं। एक तो प्यूरपेरल पीरियड है जो 7 से 14 दिनों तक पोस्टपार्टम रहता है। साइंटिफिकली इसको बोलते हैं जब तक काविंग शुरू होती है और वहां से लेकर जब पिट्यूटरी ग्लैंड दोबारा से जीएनआरएच के लिए सेंसिटिव हो जाती है, इस पीरियड को प्यूरपेरल पीरियड बोला जाता है। उसके बाद 15 से लेकर के 30 दिन, 35 दिन या 40 दिनों तक डिपेंड्स, इंटरमीडिएट पीरियड कहते हैं, जब जीएनआरएच के लिए सेंसिटाइजेशन पिट्यूटरी का बढ़ जाता है। उसके बाद जो पहला पोस्टपार्टम ओवुलेशन होता है, वहां तक के पीरियड को हम इंटरमीडिएट पीरियड की तरह लेते हैं। ये जो प्यूरपेरल पीरियड और इंटरमीडिएट पीरियड है, ये मेट्राइटिस के लिए खास है, और खासकर ये प्यूरपेरल पीरियड 14 दिनों का पीरियड है। बट हम 21 दिनों तक की बात करते हैं, आगे हम इसको डिटेल में लेंगे थोड़ा। और एक पीरियड पोस्ट ओवुली पीरियड है, जब ओवुलेटरी पीरियड है, जब पहली बार ओवुलेशन हो रहा है उसके बाद यूट्रस के कंप्लीट ओवुलेशन तक के पीरियड को हम लोग पोस्ट ओवुलेटरी पीरियड के नाम से जानते हैं। ये एक नॉर्मल सी एनाटॉमी है यूट्राइन वॉल की। मैं केवल ये बताने की कोशिश कर रहा हूँ कि जो यूट्राइन इन्फेक्शन एक्चुअली इट इज अ वेग टर्म, और जो जनरल भाषा में लोग बात कर देते हैं कि अरे इस एनिमल में यूट्रस का इन्फेक्शन है, तो ये एग्जैक्ट बात सही नहीं है मेरे हिसाब से, क्योंकि यूट्राइन इन्फेक्शन भी सब क्लिनिकल एंडोमेट्राइटिस, क्लिनिकल एंडोमेट्राइटिस है या पायोमेट्रा है या मेट्राइटिस है, एवरीथिंग इज डिफरेंट फ्रॉम ईच अदर। तो ये एनाटॉमिकल स्ट्रक्चर दिखाने का पर्पस मेरा ये है कि जैसे एंडोमेट्राइटिस की बात है, तो अगर आप ये स्ट्रेटम स्पॉन्जियोसम लेयर देख रहे हैं, यहां तक ही केवल इन्फ्लेमेशन जाता है, मींस इन्फेक्शन जो है वो डीपर लेयर में इन्फ्लेमेशन नहीं फैला पाता, डीपर लेयर तक इन्फेक्शन नहीं जाता है, जिससे टॉक्सिन्स ज्यादा डीपर लेयर तक नहीं जाते। इसका मतलब ऐसे यूट्राइन इन्फेक्शंस जो केवल ल्यूमेन तक सीमित है, ज्यादा से ज्यादा स्ट्रेटम कॉम्पैक्टम तक या स्पॉन्जियोसम तक। यस
Sir, sorry for interruption. Can we include English language also, because some participants are asking for the English?
okay, 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 I will try. So we should see that whether this infection is limited up to the stratum compactum or spongiosum, it is local infection. If the infection reaches to the deeper layers, like circular muscles, longitudinal muscles, up to mesometrium and broad ligament, then such type of infection are very dangerous, because the toxins are very much in contact with the blood, and easily toxins materials are engaged in the blood, circulate in the vital organs, and show the systemic illness sign. So I just want to say that whether infection is local or inflammation is local, limited to the lumen, there will be no systemic illness, whether there is the uterine infection. But in case of metritis, there are the systemic illnesses of sign. We will see further. So here, just for the sake of knowledge, I just want to share the uterine microbiota. It is not so that there are no type of bacteria in the uterus when the cervix is closed. There is the healthy bacteria for the uterus. As far as we know, there are the many healthy bacteria in our gut. Similarly, they are also exist in the uterus. More common, these are the firmicutes and the proteobacters. But sometime there may be sometime streptococcus and staphylococcus and some bacillus bacteria, but they are not so much in aggregate stage that it can cause the infection in the uterus. So this uterus is healthy uterus, healthy and normal uterus. But in the disease uterus, what happens? The firmicutes dominate healthy uterus, as we have seen earlier. It is shifted to the bacteroids dominant dysbiota. Means there are some anaerobic bacteria, bacteroids, Prevotella, bacteroids, Fusobacterium, Necrophorum, like this. So this type of uterus is diseased uterus. This phenomenon is called as dysbiosis. Means whatever there is the balanced biota to keep the uterus healthy. Means good bacteria are more and harmful bacteria were less in the healthy uterus. But in the disease uterus, there is the increased concentration of bacteroids and other harmful bacteria in comparison to these firmicutes. We have to know which type of bacteria these are, because only after knowing the type of bacteria we can judge our treatment after diagnosis. So I will start from the endometritis. We all know that it is the inflammation of local inflammation, just limited to the uterine lumen. It may be go deeper up to the stratum spongiosum, not further from there. So endometritis is also two types. Subclinical endometritis, as we know, we have cases. हमारे पास एक केस होगा, animal is presented for the insemination, animal is good, healthy, physiologically normal estrus, there is no improper inter-estrus interval, there is the proper estrus, and the vaginal discharge or whatever we can say ischial discharge is normal, is clear. But apart from that, there may be subclinical type of endometritis, because the animal is failed to conceive and again repeating. So how can we diagnose at the field level? See, clear vaginal discharge and there is the no signs of illness. Animal is totally fit. Rather from the feed intake to respiration rate, temperature, rectal temperature and other physiological parameter, everything will be normal. But if we take the asexual discharge and go for the white side test, it is positive. So it indicates the subclinical endometritis. To diagnose the subclinical endometritis is most difficult in the field, apart from other uterine infections. Okay. So there is the second type of endometritis. It is the clinical endometritis. In such cases, there is the mucopurulent vaginal discharge. It is seen clearly at the time of estrus. There is the vaginal discharge, and it may be on the day of heat, on the day of estrus. Sometimes owner complains that animal was in heat, discharge was clear. I have inseminated the animal with the artificial insemination, and after 2 days and 3 days, he give the discharge with the flax, with the means mucopurulent discharge. There are whitish discharge, or like curd, or like milk, or like somewhat greenish, like that. So it is the clinical endometritis, means the infection is settled in the uterus. There is the inflammation, and as we can see from our eyes, visualize. You can also see the photographs. So we can say it is the clinical endometritis. But remember, there is no signs of illness, because we now we know that this the in case of endometritis, infection and inflammation is only limited to the stratum spongiosum. There is no or least systemic involvement. Vital organs and visceral organs don't get the toxins from the bacteria in the uterus, so there is the no systemic signs of illness. Animal will be healthy, but discharge will be abnormal, and definitely it shows, and you have to decide that it is not time to inseminate, it is time to treat the uterus for its infection. So to diagnose the endometritis, there are several advanced techniques are there, like to detect the specific pathogens with the help of polymerase chain reactions and high sensitivity, rapid and specific results we are getting. Sequencing, sRNA sequencing of microbiome of uterus profiling. There are acute phase proteins whose concentration are increases at the time of uterine inflammation. There are so many inflammatory biomarkers like cytokinins, TNF alpha, interferon, like these inflammatory biomarkers are also increased and help to detect the inflammation in the uterus. Oxidative stress, no doubt there is the increase in the stress, oxidative stress, and also there is the lipid peroxidation. So there are so many techniques, but these are limited just to the lab. Now nowadays, actually at the field level, it is very difficult to use these techniques. Means these techniques are limited to the lab, they are not up to the land. Okay, so we have to diagnose the subclinical endometritis or clinical endometritis solely on the basis of the history regarding the breeding, conception, and as well as the any discharge from the vagina, and according to the signs of illness. Okay, so meanwhile, we are also should know which type of microbiota in the endometritis cases. In case of subclinical endometritis, there is the less dysbiosis. Means definitely there is the imbalance of that healthy and diseased uterus microbiota we have earlier seen in the previous slides. So, but this dysbiosis means harmful bacteria increase in the concentration with respect to in comparison to the healthy bacteria, but this disbalance is not so much heavy, so it may be called as, it may be said that it is the less dysbiosis. More common bacteria are found, maybe streptococcus, staphylococcus, E. coli, like that bacteria. In case of clinical endometritis, the degree of dysbiosis is somewhat more from the subclinical endometritis. And now here is the appearance of the newer bacteria like True pyogens, E. coli, Fusobacterium necrophorum, Privetola bacteria. So such type of bacteria may be found more in the uterus, and because of the True pyogens, it is the pyogenic bacteria. It increase the form the more and more pus in the uterus, and that pus is visible at the time of what we can say clinical endometritis. So second uterine infection, we will discuss the puerperal metritis. Listen, it is from the day of parturition to day 21. Some authors refer to up to 14, but most probably it may happen up to the day 21. What happens in case of the puerperal metritis? There is the inflammation of all of the layers of the uterus. Means infection crosses the spongiosum layer, serosal layer, muscularis layer, and reaches up to the broad ligament, perimetritis and parametritis. And if it reaches to the blood circulation, toxins easily circulate in the blood and roam all around the body, vital organs and visceral organs. And definitely there are the systemic signs of illness. Fever, there will be fever, there is a reduced appetite, loss of feed intake, loss of water intake, and other symptoms may be there. So like that, it is the puerperal metritis. what happens actually at the time of puerperal metritis? There is the acute and septic metritis. It is also called in other terms. There is the systemic signs of illness, and visible discharge is there. It is the not exact serosanguinous or not exact purulent. Actually, there is the mixing of the pus as well as the blood cells and serum. So it may be reddish brown or purulent, and there will be definitely foul smelling vaginal discharge. It may happen that first 2-3 days there is no smell will be there, but as far as the dysbiosis is increasing day by day because of the reduced immune system of the uterus, there is the foul smelling vaginal discharge. With the systemic signs of illness in that animal. There are in the fluid or whatever the discharge coming out of the vagina, there are the necrotic tissues, debris, placental tissues, it may be there. And as we know, absorption of toxins causing severe toxemia. It is the reason for the systemic illness or systemic signs of illness. So in the same fashion, we should know which type of dysbiosis occurs in the puerperal metritis. There is the strong dysbiosis. There is the huge concentration and well establishment of the true parallelopyogens, E. coli, Fusobacterium, Microforum, Privitella, bacteria. These are the very heavy concentration of the bacteria. They are exist in the uterus in the postpartum period. These are not only aerobic bacteria, they are aerobic. Some bacteria are anaerobic. Some of them are gram positive bacteria. Some are the gram negative bacteria. Like that. There may be also there is if we take the this diagnosis of the whatever the microbiota exist in the uterus at that time, there is the no single bacteria. There is a mixed type of infection, like you see here in this slide. Oh, and other type of uterine infection is called as chronic endometritis, or we can say persistent endometritis, or it is also called as clinical metritis. It is totally different from the puerperal exact metritis. After 21 days of the purgation, if there is the signs and symptoms of the vaginal discharge, so it is called as clinical metritis. Again, there is no signs of illness. There is the mucopurulent or purulent discharge will be there, but there is no systemic signs of illness. Means toxemia is not up to that level as happens in the puerperal metritis. Animal will be the bright, alert, and afebrile. There is no increase in the body temperature, water intake, food intake, everything is normal. Maybe milk yield somewhat. There is some reduction in the milk yield has been seen, maybe seen. But in the cases of chronic endometritis or we can say clinical metritis, there is no signs of illness. I am again emphasizing on the word clinical metritis. Don't confuse with the puerperal metritis, because there are the very good, well-developed systemic signs of illness in the puerperal metritis. But after 21 days, it may happen that signs has been gone, illness signs has been gone, but there is the mucopurulent or purulent discharge may be there. So it may be called as the chronic or persistent endometritis. So in this type of metritis, there is again the true parallelopyogens, Fusobacterium, Privitella, those bacteria which occur at the earlier period, but the concentration of E. coli, Streptococcus, Staphylococcus, like these such type of bacteria, they are less in concentration in this period after 21 days, because of the uterine defense mechanism, the bacteria are eliminated. Some initial phase, some beta lactamase bacteria are more in concentration, but later on they are they are cleared off from the uterine environment. It may be seen from the endometrial cytology, the percentage of the neutrophil, it reduced up to the 5% or less than 5% after 50 days, the uterus is healthy. If it is more than 5%, there is some chances of endometritis. Fourth type of uterine infection is pyometra, simple pus-filled uterine lumen. It is the localized. There is the no toxin breaches in the blood circulation, doesn't reach to the visceral organs. There is the no signs of systemic illness. Intermittent purulent discharge may be there. Definitely, you can see in the figure also. It is just like a milk or maybe like curd, slightly yellowish color. It may be. On the parectal examination, you will feel the enlarged uterus, duffy uterus. Like you just press your finger, it remains at the depressed state. Pyometra may be bilateral, or sometimes it also may be localized or unilateral. And the peculiar characteristic of pyometra, there is the presence of CL. What happens when ovulation occurs before the uterus has expelled all the exudates? We have seen in the intermediate period, like up to the ovulation, If there is the not complete expulsion of the all the debris from the uterus was not cleaned, then Cl may be persist. And if Cl is persist, there is the progesterone concentration is higher, and definitely there will be the pyometra, purulent exudate is increasing day by day, and it also interrupt estrous cycle because of the persistent Cl. Interstress interval is disturbed. So in pyometra, there may be a protozoa, trichomonas fetus may be there. Apart from that, Truparella, Fusobacterium, Pruvitella, and Vibrio fetus, like such type of microorganisms may be found in the pyometra. So these two slides, don't take it as academic, but just to clear the concept regarding the treatment, because in field conditions I have seen that there is the no facility of antibiotic sensitivity test. We are just going with the several different type of antibiotics in such cases. Apart from that, we doesn't know that which type of bacteria is there, what period is there, which type of dysbiosis is there, so which type of antibiotic should be there to use in this type of uterine infection. So we have to know the exact microbiota, microbes population inside the uterus at different condition. As we see in the subclinical endometritis, I have summarized, I have already told you all these things. You can see in the fourth row, in the fourth column, puerperal metritis. There are the different type of bacteria: gram positive, gram negative, aerobic, anaerobic. There are different type of bacteria. Means the bacterial population is very much, dysbiosis is very much higher grade in the puerperal metritis. It is least in the subclinical endometritis as well as the chronic endometritis. Again, this slide is very important. There are the actually there are so many antibiotics in the market which are acting against the aerobe, but there are very less antibiotics which are acting against the anaerobe. As we know, as we come to know now at this point, that uterus is filled with the not only aerobic bacteria, there are also anaerobic bacteria. Apart from that, there are also beta lactamase aerobic bacteria and also beta lactamase producing anaerobic bacteria. So if we going to use any antibiotic which has the beta lactam ring, these bacteria is going to neutralize that antibiotic. We should know. We know that cephalosporin is the drug of choice in uterine infection. Everyone is going to inject the ceftriaxone, cefapyrin, cefaperazone, and ceftioporsodium like that. But we should know that this antibiotic is mostly activate against the aerobic bacteria, not for the anaerobic bacteria. So either we have to use it at the appropriate time, or we have to enhance its spectrum so that it can cover the both aerobic, anaerobic, gram positive, gram negative, each type of bacteria. And here we can see that in the lactamase producing bacteria, Escherichia coli, Staphylo, these are the lactamase producing bacteria, and their concentration is very much good in the puerperal metritis after the metritis. Also they are in the clinical metritis. Prevotella, Bacteroides, Fusobacterium, they are also, I have not mentioned here true Perella pyogens because it is not a lactamase producing aerobe. Okay. So, with a summary, there are three bacteria apart from E. coli. E. coli is also very important. But apart from that, there are three bacteria: true Perella pyogens, Fusobacterium necrophorum, and Bacteroides. True Perella pyogens is actually causative agent for the uterine infection, is degenerate or damage the endometrial wall. But it remains in the lumen. Its limitation that it remains in the lumen and responsible for the pus formation. But what happens? This Fusobacterium and Bacteroides are bodyguard, act as the bodyguard for this true Perella pyogens. Like Fusobacterium produce the leukocidal endotoxins. So definitely whatever the leukocytes are there to kill the pathogens, they are neutralized by the endotoxins produced from the Fusobacterium. It is an anaerobic bacteria and it can go deeper inside the layers of the uterus. And same story is of Bacteroides. It also interferes with the phagocytes. So the phagocytic activity is depressed because of the Fusobacterium and Bacteroides. That's why true parallelopyogens remains there, established there, increase its community population, and produce more and more pus and damage more and more endometrium. So true Perella pyogens is actual bacteria, and these two bacteria are synergistically, they help the true Perella pyogens to establish the infection. Now, at the latter part of this presentation, we should discuss about the treatment. So we know that at which time, which type of uterine infection is there, and is this in this type of uterine infection, which type of microbiota is there. According to that, we can go for the treatment. So we discuss what we are doing, what we should not do, and what should be better to do. We will see in the treatment part. So treatment will be based on the four pillars. Like, first of all, we have to increase concentration of uterus to expel the mucopurulent contents. Uterus should contract and mucopurulent content should be go out of the uterus as early as possible. We have to stimulate the uterine defense mechanism so that the phagocytic activity takes place in very good condition, in very enhanced way. Sorry. Or and we should also overcome the uterine infection, whatever the micro pregnancies. So first of all, we come on in matter of endometritis. So what we should do? I have shown you that intrauterine at very first place, because the intrauterine is the choice of administration of the drug in case of endometritis. It is the much more effective endometritis. For intrauterine, we have to use such type of antibiotic which can act against that dysbiosis we have already seen. And we know there is a not very much dysbiosis is there. So broad spectrum cephalosporin may be there. Tetracycline may be a very good drug, but its concentration is needed in somewhat higher level, because MIC level is high for the tetracycline. But it is the antibiotic acts against the aerobic as well as the anaerobic bacteria. So mixed infection, tetracycline can be treated. There you can see the penicillin plus aminoglycoside. There are some researchers have reported some therapies, but not very much explored at the field level. Penicillins, when mixed with the aminoglycosides, they are very good aminoglycosides meant for the beta lactamase bacteria and other bacteria. Penicillin is itself sufficient to kill those bacteria. So intrauterine, we can go with these cephalosporins and tetracyclines. And for the parenteral route, we have to use again cephalosporins. We can use broad spectrum antibiotics there, but you can see I have written plus tazo or stazobactam or sulbactam. Again, I am saying here, it is just a revision. Cephalosporins are the antibiotic which are most accurately act against the aerobic bacteria. Their spectrum against the anaerobic bacteria is very less. We have to increase its spectrum. So the drug which are combined with the tazobactam or sulbactam, definitely they are very good for the uterine infection. Oxytetracycline, you know that it is the again this broad spectrum antibiotic. Penicillin, but along with the beta lactamase inhibitor like amoxicillin, ampicillin, piperacillin, but fortified with the tazobactam or sulbactam or clavulanic acid, potassium clavulanic acid. Such type of antibiotics we can go for the parenteral, because the infection is mixed. We can go with the hormonal treatment with the estradiol, and after some time we have to inject the oxytocin after 5 to 6 hours. Estradiol leads to improves the sensitivity and number of the oxytocin receptors, and then oxytocin is going to contract the smooth muscles of the myometry of the uterus. Because of the contraction in the uterus, whatever the content or exudate filled inside the uterus, more and more will be come out, and the severity of the infection and inflammation will be reduced. PGF2 alpha analog, but condition is there if CL is there. If corpus luteum is present on the ovary, in that cases PGF2 alpha is effective. Otherwise, no need to give the synthetic analogs of these PGF2 alpha prostaglandins. And two most important things: immunostimulants. If we give the immunostimulants which improves the immunity status of the body of the uterus, definitely it is going to reduce the infection as early as possible. And the mineral mixture and vitamin A, D, 3E, these things also add to the improve the immune system. And because of that, we have to add on these two things in our regular therapy. So it may be a line of treatment for the endometritis. In case of metritis, as we know, there is the severe systemic illness, strong dysbiosis, and everything, whatever may be the worst with respect to the uterine infection is there in the puerperal metritis. There is severe toxemia, septicemia. There is the huge number of bacteria doing the uterine infection. We have to go with the suppletive medications also needed, uterine debris, exudate, all these things. So regarding the treatment of metritis, we can say that we know there is the systemic illness of sign, systemic signs of illness, and means if we want to bring the animal back into the normal physiological condition, first of all, we have to remove the toxins from the bloodstream. We have to remove the toxins from the body. And we know we have the two detox centers in our body. One is liver and other is kidney. So definitely we have to take care of these two organs. Means that this last thing, liver tonics and immune stimulants, it definitely going to support your therapy. And apart from that, the fluid therapy is very much. As much as fluid you are giving in the body, the concentration or severity of the toxins in the blood is going to be reduced. These are as early as possible excreted with the help of the kidney. So fluid therapy is the magical therapy in case of metritis, because you are giving the antibiotic. Bacteria are going to be killed. You are saying to the owner that I have given the antibiotic, everything is okay. But owner will come to know that everything is okay if its animal is become afebrile, means temperature becomes normal, and it starts eating, taking water normally, normal active. So it is must. Fluid therapy is the must for the in cases of metritis to bring the animal in a normal physiological condition. Same thing, there is the very difference, very diverse type of microbiota presence population is present in the uterine environment. So we have to use the antibiotic. In this case, parenteral antibiotic is more important because we know that there is a toxemia as well as the septicemia. We can go with the this broad spectrum cephalosporins, but it is more good if it is fortified with the tazobactam or sulbactam. Oxytetracycline we go, metronidazole. So we should go with the combinations like, for example, metronidazole. It acts against the anaerobic bacteria and some protozoas, but it is not active against the aerobic bacteria. So what about the E. coli, Streptococcus, Staphylococcus? So we have to use the broad spectrum antibiotic. We can go with the cephalosporins drug with the metronidazole. We can go with the cephalosporin drug fortified with the tazobactam and sulbactam. Also, the beta lactamase producing bacteria, we have already seen that E. coli, Streptococcus, Staphylococcus, Fusobacterium, Necrophorum, Prevotella, Bacteroides, all sorry, all these bacteria are the beta lactamase. If you are going to use the penicillin, like amoxicillin, yeah, fortified procaine penicillin, penicillin G, like such thing. So it is not going to the work very well at the initial stage because their beta lactam ring will be damaged by that beta lactamase enzyme produced by the bacteria which is present at that time in the uterus. So it should be also fortified with the tazobactam and sulbactam, like amoxicillin with the clavulanic acid, ampicillin, piperacillin with the sulbactam, like that. So this should be the spectrum of the antibiotic we have to use. And definitely there is the severe inflammation. We have to use the anti-inflammatory agents, NSAIDs. So in NSAIDs there are the meloxicam, ketoprofen, flunixin, meglumine. There are so many anti-inflammatory. Anything you can use, but flunixin meglumine is considered at the top. It is considered as the drug of choice regarding the anti-inflammatory agent in cases of metritis, because it also has some anti-endotoxic effect. That why flunixin meglumine is good to use in cases of metritis. Then we can go with the there are so many herbal uterine embolics in the market. They are going to contract the uterus, and the uterine content will come out of the uterus because of the severe contraction. PGF-alpha we can go. If corpus luteum is there, or some tissues of corpus luteum are there, it definitely go to the lysate. But if there is no corpus luteum, so then just the use of the PGF-alpha is the slight embolic effect on the uterus, nothing more than that. Oxytocin, it is a strong smooth muscle contractor, but there are the oxytocin receptors remain up to the 48 hours after the parturition. Sometimes it may be go up to the 72 hours. So if a case presented to you within 2 days or 3 days after parturition in front of you, so you can go with the oxytocin. Definitely it will help to contract the uterus and remove the exudate from the uterus outside. To reduce the shock, we have done the fluid therapy as well as the corticosteroid. We can go with that. Liver tonic and immunostimulant supportive therapy we should give to improve the activity of the liver, because it also detoxify the toxins whatever present in the body, and which is the actual responsible for the systemic illness in case of the metritis. So this should be the line of treatment of metritis. There are somewhat difference in the endometritis and metritis. In case of endometritis, we have seen that it is a local infection. So local antibiosis means intrauterine is the route of choice to treat the endometritis. But in case of metritis, intrauterine is contraindicated because because of the intrauterine uterine wall is very fragile, very fragile. It can, if you insert the intrauterine gun, it may damage the uterine wall, and if there is damage, the infection and inflammation aggravates. Also, there is a presence of so much amount of biological fluid. There are the debris, there are the pus, there is the dead cells, dead leukocytes. There are so many bacteria. Because of that, the effect of the intrauterine is not up to the mark in cases of metritis. And also one more thing, in case of endometritis, we have seen that we can go with the estrogen and oxytocin to remove the exudates or improve the blood circulation and improve the
Sir, your voice is not coming, sir.
hello,
Sir, can you repeat it again? क्योंकि बीच में अभी
from
वॉइस
where?
चलेगी थी अभी वॉइस
Okay,
चलेगी थी
अभी आ
सर,
रही
कैन
है?
यू रिपीट इट? हाँ, आ रही
अभी आ रही है?
आ रही है, आ रही
ओके, सो क्या मैं स्लाइड पूरी बोलूं दोबारा से?
नहीं सर, ये यूटेराइन इक्बॉलिक एंड हर्बल उसके बाद।
Okay, okay, okay. So there are so many herbal uterine ecbolics are present in the market. It's going to contract the uterus so that more and more exudates come out of the uterus, and definitely it reduces the severity of the infection inside the uterus. We can manage the shock with the help of fluid and corticosteroids. Definitely we have to improve the action of the liver with some liver tonics, with some supports, because we know that the liver is going to detoxify the much and much toxins. So this should be the line of treatment in case of metritis. But one thing I want to repeat, because there was a break in the voice, there is the difference in the treatment of endometritis and metritis. Two major difference, actually three major difference are there. First, in case of endometritis, there is no systemic signs of illness, so there is no need of fluid therapy. But in case of metritis, there are the toxins in the blood. We have to take it out of the body. So the fluid therapy is the proves magical therapy in case of metritis. It is indicated. We have to go with the fluid therapy. Okay. Again, like intrauterine, we have seen that in case of endometritis, the intrauterine therapy is the choice of route for the administration of the antibiotic uh, uh, better than the parenteral antibiotics. But in case of metritis, we have to go with the parenteral antibiotic. Intrauterine therapy is considered as the contraindicated in cases of metritis because of the uterine wall is very fragile. If there is any damage to the uterine wall because of the improper insertion of the uterine gun, so the infection and inflammation will aggravate. Also, there is the presence of so much amount of the biological fluid, leukocyte, dead bacteria, live bacteria, pus is there, and fetal fluid is there. So many things are there. So in presence of the good amount of the biological fluid, the antibiotic not going to act on the wall. So intrauterine is not very good for in case of metritis. But one thing I want to share, as a clinician, case when comes to me or comes to an veterinarian, it will not going to present again and again for day 2, day 3, day 4. So precautiously we can go for the very good antibiotic for the intrauterine. just for the 1 or 2 days or 3 days, maybe there. But theoretically and scientifically, intrauterine is contraindicated. Third difference is that in case of endometritis, we have given the estrogen followed by oxytocin. But in case of metritis, estrogen is contraindicated. In case of endometritis, if we give the estrogen, there is the improved blood circulation and there is the more and more leukocytic infiltration. Infection will subside. But in case of metritis, if we give the estrogen, there is the improved blood circulation in the body, in the uterus, and there is the no doubt there is the much infiltration of the leukocytes. But along with that, toxins whatever present inside the uterus or uterine layer, it also go in more quantity inside the blood because of the improved blood circulation, because of that estrogen. And more toxins circulate in the body, the systemic signs of illness may go worse. So estrogen, we have not go with the estrogen in case of metritis. We should not go with the intrauterine in case of metritis, and we should go with the fluid therapy in case of metritis. And apart from that, antibiotics and anti-inflammatory we have already discussed. And in case of pyometra, where we know that there is the pus, and if you remember, there is the persistent CL. Because of the presence of the CL, the immune system is at the stake because of the high progesterone. So in case of luteolysis is the choice of mode of the treating the pyometra. So we can go with the some prostaglandins, cloprostenol sodium we may give, or we may give the some natural prostaglandins to do the luteolysis. So when corpus luteum is lysed, progesterone level comes to the normal, and definitely pyometra may be treated. We can go with the broad spectrum antibiotic. We can also go with the intrauterine antibiotics and estrogen if you want, but it is not needed to go with the estrogen and oxytocin. But definitely estrogen and followed by oxytocin, if you are giving, there is the contraction of the uterus, and more this exudate or pus whatever inside the uterus will come out. So as there are some recent advancement in the diagnosis, so there is also some recent advancement for the treating the endometritis. Like they are using the antibiotic sensitivity test on the basis of selective antimicrobes, and according to that we can go for the selective antibiotic. There is the anti-inflammatory therapy with the use. We are using the probiotics and microbiomes from the lactobacillus, from the lactic acid bacillus, with and without the silver nanoparticles we are using to treat the there are evidence to treat the endometritis. We are going with the antimicrobial peptides, AMPs they are known as. It is also used for treating the this endometritis. Bacteriophage therapy is there. Mesenchymal stem cell cyclotomes, in which lyophilized materials used for the intrauterine. 2 intrauterines are done 14 days apart, and it shows a promising result in treating the infection and inflammation, reducing the infection and inflammation in case of endometritis. Also, there are so many herbal preparations, indigenous herbal preparations are also tested for the reducing the infection and inflammation, like garlic extract. Some uses are there. Use of the neem oil is there, and some people use the ozone therapy to treat the uterine infection and inflammation. So there are so many different type of therapeutic regimes are going to be used to treat the endometritis. But actually, again, I want to say that regarding these particles or materials, there are no market-based preparations. So it is not very much popular at the field level. It is just limited up to the lab only nowadays. So what we have go with the other therapies what we have seen earlier. Okay. So these are some recent advancements regarding treatment of endometritis. So I will conclude my presentation with this. Take home message, we can say that if on the basis of history and science, definitely on the level of field, it is very difficult to diagnose the case, exact diagnosis. But on the history and science, whatever the science in the body, activity, fever, feed intake, water intake, vaginal discharge, all these things. According to that, we can go with the exact diagnosis. Also, we can go this history and science are fortified with the time frame. at what time frame that infection is exist, we can go for the exact diagnosis. And accordingly, if we are able to diagnose the case exact, now we are well to able to know that which type of microbiota is there. According to that, we can go for the treatment, and definitely we can manage the reproducibility of that animal or culling rate of that animal, whether it is treated in large herd or out of country in the large herd, well managed herds. In case of metritis, if animal is treated for the metritis, after treatment the animal will be culled. It cannot be used for the breeding purpose. But in case of India, where there is very deorganized this dairy sector, every farmer have one animal or two animal or three animal. They cannot afford the culling. So we should go with the exact diagnosis and treatment for those farmers. So there are so many products in the market to improve the immune system of the uterus. So definitely we should go with the dewormer, so that no other parasite going to use the whatever the minerals or vitamins or whatever the nutrition you are giving to the animal. Parasites will take it. So we have to reduce, or we have to kill all the parasites with the help of the dewormer to improve the immune system of the body. There are the different type of mineral mixtures in the body, in the market. There are some glycine chelated, some methochelated. So according to that, you can choose, go for the mineral mixture. There are so many injections with the copper, zinc, magnesium, vitamin E, selenium, like that. And also these act as the immune modulators. And also there are so many immune modulators also present in the market. And there are also there are so many products where present in the market with the different type of antibiotics, cephalosporin fortified with tazobactam, sulbactam, which is the need of the time in case of, especially in the case of metritis. Different type of intrauterine broad spectrum antibiotics we should use, especially in case of puerperal metritis. We should use the medicines which are going to regenerate or treat the damaged endometrium, so that it can prepare for the further conception or pregnancy. So these things we can go and we can treat the animal accordingly. So thank you guys. I think I have delivered whatever the things on the basis of my experience or my academic experience I have shared with you. Now I think topic will be open for the discussion, and you can go for the any question. Please, Dr. Akanksha, Dr. Tanmay, please.
Yes, sir. Thank you very much, sir. Your presentation is very nicely, and it's very valuable and insightful, because it will help definitely to our practitioners in the field condition how to diagnose the metritis, endometritis, and pyometra, and what is the right treatment for that condition. It's very useful presentation. And now session is open for question answering. If anybody have any doubt regarding the today's seminar, they can put their questions in the chat box. Dr. Kansha?
Yes, sir. So we have received a few questions. We will start from the first. First question is, sir, should we perform AI in spite of intrauterine cephalexin antibiotic?
Ma'am, please repeat. Your voice was breaking. Please repeat once again.
Should we perform AI in spite of intrauterine cephalexin antibiotic?
If there is the infection in the uterus, we should go for the treating the uterus first of all, then we should go with the AI. If the complete infection from the uterus is not vanished off, then there is the very difficult to survive the sperm travel through the this infected uterus. And also, if anyhow it go and conceive with the fertilize with the oocyte, and there is the conception, when embryo roll down back into the uterus, it will not implant on the uterine wall because of the inflammation and infection. So we have to go with the intrauterine therapies for treating the uterine health, and after that we can go for the AI. But in cases of subclinical endometritis or very limited cases of the clinical endometritis, if the severity of the inflammation and infection is very less, we can go for the intrauterine therapy in that animal, and the antibiotics takes 5 to 6 hours maximum to absorb from the uterus. So it's going to clear the uterine environment from the infection, and so that we can go after 6 to 8 hours or 10 hours, we can manage for the intrauterine. Means, for example, if an animal is comes in the heat in the morning hours and it is the repeat breeder and you are suspecting the subclinical endometritis, and means severity is very less, so we can go with the antibiotics in the morning hours, and in the evening hours we can go for the AI, and we can also repeat the artificial insemination 12 hours apart.
Okay, the next question is, does serratiopeptidase have any role in IU therapy?
Please, pardon?
Serratiopeptidase molecule, serratiopeptidase enzyme have any role in IU therapy?
Serratiopeptidase.
Yes.
Yes, definitely it is a proteolytic enzyme. It is going to regenerate the this endometrial wall. The intrauterine therapy, there are some market preparations are there with the cephalosporins fortified with the serratiopeptidase. Definitely they are very helpful to improve the health of the endometrial wall.
One hand is raised, Mr. Arki. Rahul Kumar. Yes, you want to ask something, Mr. Rahul Kumar? Unmute yourself and ask the question.
राहुल कुमार, आपका क्वेश्चन है, आप चैट बॉक्स में डाल सकते हैं।
ये ज्यादा अच्छा है अगर चैट बॉक्स में डालें, क्योंकि आवाज थोड़ा सा ये इको कर रहा है,
राइट,
तो मैं चैट बॉक्स पे देख के आपको जवाब दे सकता हूँ।
And sir, can you repeat it, 4 pillar of treatment again from your presentation? 4 pillars of treatment.
Yes, sir. Should I go for the sharing presentation or just I can tell you that actually we have to go with, first of all we have to improve the this uterine immune system. Whatever the self health mechanism of the uterus, we have to improve it. We have to give such type of medications which can clear the exudates from the uterus. And other thing, we have to tackle with the whatever the uterine infection is there, means what is the microbiota are there. According to that, we have to treat it with the respective or that antibiotic therapy. We have to go with that. And just to improve the immune system, we have to go with the antivirals and mineral mixture like that. We have to improve the uterine health so that it can be prepared itself for the next conception. So I have seen one question, Dr. Shiv Kumar Basotia sir. Are antibiotics such as gentamicin or oxytetracycline beneficial when used during or before artificial insemination to prevent bacterial contamination and improve conception rate? Definitely they may improve, but you have to diagnose first of all what is the actual cause of the repeat bleeding. In that case, if it is the hormonal cause, then there is the no work of the antibiotic, and if there is the subclinical endometritis, then definitely gentamicin or oxytetracycline will work there. But for the oxytetracycline, we have to use in very high concentration. So we can go with the gentamicin. It take care of the aerobic bacteria, and some sort of the spectrum of gentamicin is for the anaerobic bacteria. So it may be beneficial, but I think there is no study on very large sample population of the animals, which we can generalize this statement that giving the antibiotic like gentamicin or other antibiotic beneficial at the time of insemination. Can we inject PGF2 after removing retained placenta? Yes, definitely. We know that I have told you that at the time of parturition, corpus luteum is lysed because automatic corpus luteum is degenerated because there is the at the time of parturition. So after in the cases of retention of placenta, there is no corpus luteum. So definitely your PGF12 injection is not going to work against that for that luteolysis. but definitely it's going to contract the uterus up to some extent. But apart from that, it is very good if it is the within the time frame of 2 to 3 days. We can go for the oxytocin. There are some ergometrine preparations in the market, methyl ergometrine. There are some other uterine embolics are there. We can go with the that in place of PGO-12, these drugs may prove more effective in case of after removing the retained placenta. Dr. Bala, am I clear? Dr. J, sir, in case of subclinical endometritis, can we make the diagnosis in field level by only measuring the pH of CVM? Yes, we can go. We can go for the white side test. We can go with the cytobrush technology. There are so many technologies. But as far as I met so many veterinary officers in training hours, in other such type of things, it is very difficult to take over in the field level. But definitely we can go for the this CVM and measuring the pH of CVM in case of subclinical endometritis. Bala is asking the line of treatment for pyometra. Line of treatment pyometra, I have discussed. Once again, I am telling you that PGO-12 is the drug of choice for the pyometra, because in case of pyometra, there is the existence of the corpus luteum, there is the persistence of the corpus luteum. So we should go with the PGO-12. As far as there is the no systemic signs of illness, so it is not much needed to go with the parenteral therapy. We can go with the intrauterine therapy, and herbal embolics will prove very good in case of pyometra, because we have to just clear the pyogenic membrane and whatever the pus filled in the inside the uterus, we have to just clear it out. So with the uterine embolics and PGF-12 and some sort of intrauterine drugs, we can handle the cases of the pyometra. Ajit Kumar, thank you, Dr. Saab. This. Is it normal to have discharge? Is it normal to have discharge like blood 2 or 3 days after AI, or is it an infection? If it is an infection, please suggest treatment. First of all, Mr. Ajit, it is not the infection. But you can see the discharge of the blood. It is the metritis bleeding in case of bovines, and it is the characteristic of the mixed breed animals or foreign breeds like Jersey or Jersey crossbreed, Holstein Friesian, Holstein Friesian crossbreed. These animals show such type of symptom. But it is a metritis bleeding. It is a natural process. It is not an infection. It is nothing to do with the repeat breeding. It will not going to hamper your artificial insemination process or conception process. So I think you are clear, as it is not it is a physiological thing, so we should not go for the any treatment. It is normal. In indigenous animals, very rare you can see the metastas bleeding. Most probably it can be seen in the exotic animals, exotic breeds and mixed breeds. Will a certificate provided for the webinar? I think Dr. Tanmay,
Yes,
Dr.
yes,
Akansha
definitely. Yes,
should answer for
definitely.
that.
Definitely,
Dear
sir, we
sir,
will
is
provide the certificate.
biotrim is also effective on metritis, endometritis in pyometra? Actually, I didn't go through any literature which with the use of this biotrim. So I cannot say at this time, but you can go for some academic papers if the biotrim is active against the this spectrum is broad with respect to gram positive, gram negative, as well as aerobic and anaerobic. Definitely it can be used for the metritis as well as the clinical endometritis. 2 infection at time. Present ROP case, pyometra and endometritis. 2 infection at time. Present ROP case, pyometra and endometritis, pus debris, given injection, safety for LA and metal injection. I don't know what is metal injection. Use
I think
enrofloxacin, intrauterine, good choice. That what? Yes, yes, please.
I think it's a mineral injection. He's the one to write.
Okay, mineral injection. It's okay. And what is the question? I didn't understand. Use of enrofloxacin. Enrofloxacin cannot be good for the intrauterine therapy. It is not a good choice because the spectrum of enrofloxacin is not very much for the anaerobic bacteria. Definitely, it is good for the E. coli, Streptococcus, Staphylococcus, but the 3 main bacteria I have told you: True Perella pyogenes, Fusobacterium necroform, and Bacteroides, some Prevotella and Bacteroides. So I don't think that enrofloxacin is a good choice for the intrauterine. Sir, King cervix treatment and symptom. Actual, there is no treatment of kinked cervix because it is an anatomical defect. And what is the symptom? You just go for the parietal examination, you can feel the kinked cervix. Regarding the management, in such type of animals, there is very difficult to perform the artificial insemination. So we should advise the farmers to go for the natural insemination in such cases, because the kinked cervix is nothing to do with the fertility, conception, or pregnancy or parturition. If it is going to be fibrosed or there is adhesion, if it is the reason of the kinking of the cervix in that animal, definitely there will be a problem in the at the time of parturition. Is there any utility of vitamin E in combination of intrauterine antibiotic while we treat uterine infection? Actually, we are not, there is no use of vitamin E to treat the uterine infection, but vitamin E can act as the antioxidant, as we have already seen that there is the increased lipid peroxidation as well as the oxidative stress at the uterine level. So definitely vitamin E, tocopherol, can be used in the combinations with the different intrauterine antibiotics. So vitamin E is okay. It is not going to worsen your condition. It will improve the condition and help in the regeneration as well as the reducing the oxidative stresses in cases of uterine infections. Drug of choice in the presence pus. Actually, we should go with the broad spectrum antibiotics. Cephalosporins fortified with tazobactam and sulbactam is best for the uterine infection. Apart from that, if it is not going to treat with one antibiotic, two antibiotic, three antibiotic, you should take the sample and go for the antibiotic sensitivity test. Then only we can we can come to know that which drug is the drug of choice in case of this in that particular case. Clear, doctor. Thank you. Okay, I am scrolling. In endometritis, safety for antibiotic therapy for how many days can be done? Sir, actually, in case of endometritis, I don't think you should go with the. We have also saw the economic status of the honor also, because it is the most expensive one of the most expensive antibiotics in the market. So if you think that there is not very much infection, is endometritis some clinical type, we should not go with the safety over sodium. Okay, antibiotic therapy. Antibiotic therapy, if you are going to parenteral route, you have to take care. If there is the no systemic signs of illness, you need not to go with the parenteral therapy. For the intrauterine therapy, you can go with the like one combination I am telling you: oxytetracycline, broad spectrum antibiotic plus metronidazole. You can go with the intrauterine with that most effective and least expensive for the intrauterine therapy. It will cover the every type of bacteria. We should avoid the penicillin type of antibiotics or penicillin group antibiotics in earlier days postpartum because beta-lactamase bacteria are more. If the penicillin drug is fortified with clavulanic acid, tazobactam or sulbactam, then definitely we can go with that. Can we use Lugol's iodine endometritis? Yes, we can go for the Lugol's iodine endometritis. In case of subclinical endometritis, there is a repeat bleeding, we know. But there are so many evidences that if we are only flush the uterus with the help of normal saline, it improves the conception rate. So Lugol's iodine in a very less because it is an irritating agent, it is the oxidizing agent, it is irritating for the endometrium. So its use should be cautious. It is better to use, we can go with the diluted povidone iodine solution. We can also go for the treatment of the endometritis. And it will work on the cases of endometritis, definitely. Lugol's iodine. Jagat Prajapati, dear sir, is biotrim is also effective on metritis? Some other person also asked this question. At this point, I am sorry, I cannot tell about the what is the effect of biotrim on the uterine infections, because I have not go through any literature using the biotrim. If at the field level, if you are using the biotrim, then only experience can tell that biotrim is can be used or not, or either you should go with the spectrum of the biotrim. That's why I have added 2 slides in my presentation and emphasizes on the types of bacteria present in a different type of uterine infection, so that the choosing the antibiotic becomes easy for you guys, that which type of infection, which type of bacteria are there, and which type of antibiotics I have to do.
Sir, I want to add something in the Jagat Prajapati question. Biotrim Jagat,
Uh,
Biotrim is the product of the Genex Animal Health, and we are promoting this product in the diarrhea cases. As sir mentioned, there in Biotrim there is a composition, there is a sulfur drug. So we need to identify the sulfur drug is effective in the uterine tract infection or not. Currently, we
sulfadiamidine
are
is not, sulfur drugs are not very much effective in uterine cases, uterine
right.
infection.
So Jagat, your
It
answer
is
is
good.
Biotrim is mainly used in the diarrhea cases.
It is very good drug with very good antibiosis agent in case of GI tract ailments, but
Right.
it is not very good for the uterine infections. Uh, okay, सांगले गणेश जी पूछ रहे हैं यूट्रस फाइब्रॉइड पस discharge lift horn tumor not required given few antibiotics intrauterine not cured guide. I didn't understand. If there is no fibroid, then how can you expect that it is going to be treated with the antibiotic? I don't think so. We have to go for the surgicals. What is the role of progesterone and cystic endometrial hyperplasia causing the pyometra? What is the role of pyometra? Ashwini Kumar. As the basis, I have told you that progesterone, when there is the dominance of the progesterone in cases of uterine infection, uterus become susceptible for the uterine infection. Progesterone is very good agent to procure the infection inside the uterus. Mainly in case of, I think you are asking in case of canine pyometra. In case of canines, progesterone, see, it is the endometrial blockage agent. First of all, it holds the cervix at its position, closed, partial open, then partial open. So the complete pus cannot be evacuated out of the uterus. Second thing, progesterone is responsible for the endometrial hyperplasia because it attacks the pregnancy hormone. All we know, it stimulates the secretion or milk secretion, healthy diets from the endometrial glands, and because fetus in initial stages needs that fluid. But if there are the bacteria, then definitely bacteria are also going to enjoy this uterine milk. Progesterone is responsible to proliferate, to give the nutrition to the bacteria so that they can increase their population in very good manner. Third thing, progesterone also provide the adhesive sites for the E. coli, which is the main causative agent of the in cases of canine pyometra. Adhesive sites is so that much colonies of E. coli established inside the uterus. So with these things, I can say that progesterone is the key hormone responsible to causing the pyometra in canines. Okay, Bala, in HF animals, hypoplasia of ovary occurs after second calving. How to treat? There is no treatment of, I don't think there is a treatment of hypoplasia of the ovaries. If it is the unilateral, then we have to wait for the ovulation from the contralateral ovary. But if it is a bilateral, then we cannot do anything. But and the other thing, I don't think that I didn't go through any cases with such type of cases that hypoplasia occurs after the second calving. Doses of oxy and metronidazole intrauterine. So I am not going with the doses. You should go with the literatures. You should go with the internet and your academics papers, what you are having. But for the intrauterine, we should not go beyond 50 to 60 ml. It is the maximum. We should not go apart from that. Like metronidazole, the bottle presentation in the market is 100 ml. If you are going to introduce the metronidazole 100 ml, then definitely the uterus wall is fragile. Then uterus wall may be ruptured. Uterine fluid may be percolate of the uterus. It may go to the abdomen or peritoneum, and it will cause the peritonitis. First of all. Second thing, if there is no percolation of fluid, uterine fluid, abnormal fluid in the peritoneum, huge amount of intrauterine fluid push the uterine exudate toward the salpinx, means toward the fallopian tube and toward the ovaries. So it may cause the inflammation of the fallopian tubes. It may cause the inflammation of the ovaries. And if from the infundibulum it will go inside the abdomen, and again it may cause the peritonitis. So it is not good to give the huge amount of metrogyl, 50 to 60 ml. I am just saying you, Mr. Bala, that we can go with the 3 gram of oxytetracycline along with the 40 to 50 ml of metrogyl. We can we should go with this mixture, for we can go for the intrauterine therapy. What is the recommended time interval between two consecutive ceftiofur injection? Ceftiofur injection, I think it is the half-life, it is up to 12 hours. Plasma level, it can be maintained up to 12 hours. It is very good to give the cephalosporins drug at the interval of 12 hours. But in practical, at the field level, it is very difficult to go for the such huge antibiotic with this frequency. So it is okay if it is fortified with tazobactam and sulbactam, and there are some LA compounds, long acting compounds are also there in the market. We can go with them for the 24 hours. Sangle Ganesh, cow ester cycle and after few bloody discharge, repeat and repeated cow 7 times. I have told that the bloody discharge from the after the estrus, it is the metritis bleeding. It is nothing to do with the repeat bleeding. There is nothing to do with the misconception. So what is the actual cause of repeat bleeding? You have to go through. Like it may be from the side of female, it may be from the side of male, maybe there is the delayed ovulation, maybe there is the anovulation, and there may be the uterine infection may be there. Like there may be so many reasons may be there, for because managemental causes may be there, different type of stresses may be there, and in the male side maybe there are faulty AI, faulty semen, or dead spermatozoids are injected in that case. So you have to trace out what is the actual cause of repeat bleeding. It is a tough job, very tough job. Does the dose of fluid therapy in metritis cases? You can go with the just means huge amount of fluids you cannot introduce intravenously in the animal, because it may cause the hemodilution also. So if there is no fever, we can go with the ringer lactate. If there is fever, if there is no fever, we can go with the ringer lactate or DNS solutions. And if there is the febrile condition in the body, temperature is high, we should avoid the ringer lactate solution because it aggravates the fever condition. So we can go with the simple NS, not DNS, because DNS contains the dextrose 5%, and above them it is not to say 10%, 20%, 25% dextrose preparations are there in the market. It will aggravate the this infection because there is the dextrose. So we should go with the normal saline. And at the field condition, what I can say that we can go for the 3 to 4 liters at one time. We should repeat it for 2, 3, or 4 days. There will be the magic. Definitely magic if you are going with the fluid therapy and very good broad spectrum having antibiotic. Okay, dose of fluid. Is there a way to prevent all this type of UTIs? Which type of care we should take? See, any type of infection in the body is going to be cured by the immune system of own body. So ultimate thing is that we should go with the therapies, or we should go with the materials which are going to improve the immune system of the body. In the last 2 slides, where there are the display of many market preparations of different types of medicines, if you focused, I have seen the first slide with the dewormer, mineral mixture, and immune stimulants. These are the medicines which can be considered as the management therapies to reduce the chances of such type of this uterine infection. And if you are meant with the UTIs means if you are asking about the urinary tract infection, which is commonly called as UTIs, so I am not the exact person to give the suggestion on the UTIs infection. Okay, if it is uterine infection, then definitely we can manage it with the immune stimulants, dewormer. We have to improve the nutritional status, like carbs with, see, like protein diet. Protein diet is not going to improve the conception rate or breeding status of animal. So the maintenance dose of the protein is okay. We have to concentrate on energy diets. Okay, so immune system will improve with the immune stimulants and other type of minerals in corpus, copper, zinc, cobalt, like this. So we can go with that to manage these cases. Sir, provide iodine and metronidazole. Sir, povidone iodine. Okay, povidone iodine and metronidazole is used in metritis or not? You can use anything in the metritis, but we have to take care that actual they are covering the whole spectrum of the microbiota in the uterus. Like povidone iodine is a oxidizing agent. Definitely, it will work best against the anaerobic bacteria. Metronidazole again have the spectrum against the anaerobic bacteria and some protozoas. Then what about the aerobic bacteria? What about the E. coli? What about the Streptococcus, Klebsiella, Proteus? What about that? So we should not go with the such preparations. मार्केट में कोई यूज कर रहा है, फील्ड में लोग तरह तरह की प्रिपरेशंस यूज करते हैं उसको, तो उसको आप वो सही भी हो सकती हैं, वो गलत भी हो सकती हैं, आपको देखना पड़ेगा। तो हम ऐसे मिक्स नहीं कर सकते किसी भी दो चीजों को, ऐसे तो ढेरों क्वेश्चन बन जाएंगे कि इसको इसको मिला के दे दें या इसको इसको मिला के दे दें या इसको इसको मिला के दे दें। वी हैव टू टेक केयर ऑफ द स्पेक्ट्रम ऑफ द माइक्रोबायोटा प्रेजेंट इन द पर्टिकुलर यूट्राइन इन्फेक्शन केस। Sukumar, Dr. Sukumar, thank you, Dr. Chan, for such effective info. Okay, thank you. It was really valuable, enriching. You could please arrange a webinar on repeat breeding by Vikas Sachan, sir. Okay, I am sure it would be very informative and helpful for all us. Okay, Sangle Ganesh, cow not grown, ovary size very low, no show estrus. Again, we have to go with the nutritional treatment. It is the genetic defect, it may be the anatomical defect, maybe there it may be the case of aplasia or hypoplasia. But if it is not so, then definitely what can we do to improve the nutritional status? It can only help to maintain the normal size of ovary. If it is not going to maintain the normal size of the ovary, cull the animal. It is not very good animal for the breeding. Okay. MD Taslim Anwar ji कह रहे हैं, sir, can you please throw procedure over ozone therapy for treatment of endometritis? Actually, one of my colleague, Dr. Jitendra Agrawal, very excellent gynecologist in my department, he has done a small project on this therapy. Actually, it is not good for, at the field level, but at the experimental level, he has done and proves that ozone therapy is effective in case of endometritis. So actual detailing regarding that ozone therapy, I am not sure that how much amount of ozone is going to be injected inside the uterus, but it needs some ozone producing instruments and some trivol type instruments. So there are so many systems are there. I don't know about that, but ozone therapy are may be considered as a good therapeutic agent for the cases of endometritis. I think, Dr. Kancha, I have given answer of all the questions.
Yes, sir, absolutely. So the amount of questions that we have received, it shows that what an impactful webinar it was, sir. So I think with this, we will conclude the session. So on behalf of Zenex, we would like to extend our heartfelt thanks to you, sir, for taking time out of your very busy schedule and making time for us. And I'm sure for all the attendees, they were able to gain very big knowledge and broad knowledge about the uterine infections. So thank you so much again, sir. And for the attendees, thank you so much for joining our session. We will continue our series.
I'm also thanking Zenex. Please accept it so that you have exposed me in front of more than 200 people, so that at least some people have gained some knowledge, and definitely it will be help our farmers and livestock keepers at the field level, whatever the attendees are there, veterinary officers or other veterinary practitioners. So very much thankful to Zenex, and I will be very grateful for such type of opportunities in future also.
Thank you so
Your
much.
next topic already is here, repeat breeding by Vikas Sachan sir. Definitely, we will do one more webinar on repeat breeding, and our speaker is same, Dr. Vikas Sachan sir. Definitely, we will meet in future again, right?
Okay, no problem.
So thank you very much, sir. Thank you, everyone.
Thank you, Zenex. Thank you.
Thank you, sir.